On Great Day, Colorado, but mental health is a topic that is very serious and something we all need to talk more about. PTSD is something a lot of us face, and Family Care Center is here to educate us on the signs. Here to share more is Dr. Charles Weber, the founder and chief medical officer at Family Care Center. Welcome to Great Day, Colorado.
Yes, thanks. Thanks for having me back.
Yeah, happy to have you back. So we're talking about PTSD. For those out there who might not know much about it, can you break it all down for us? What does PTSD stand for?
Sure. It stands for post-traumatic stress disorder. And so we see post-traumatic stress in people that have been exposed to a severe trauma. This happens about 6% of the population, but it might be as high as 10 to 15% for our military, our veterans, and our first responders. And we've become experts in that field at Family Care Center.
Absolutely. So what are some of the symptoms that those with PTSD really get on a day-to-day basis? What are they dealing with that we can't understand if we don't have it?
For sure. Well, there's basically the criteria is going to be some kind of exposure to a trauma, and then you're going to be re-experiencing that trauma over and over. You're going to try to avoid it. It's going to cause a lot of negative feelings, and then you're going to have this hyper-arousal kind of portion or hyper-vigilance that is going to be pretty pervasive throughout your day. And you can imagine just one of those symptoms, much less all five.
Okay. And what are some of the traumas that can induce PTSD?
Sure, that runs the gambit of our human experience. And so that might be a motor vehicle accident, witnessing a death, witnessing a burglary, an assault, something much more horrific. And of course, war, first responders, fires, or terrorist events, or even actually natural environments too. So death from a tornado, a hurricane that we've kind of seen recently. All of those things could induce an environment that you could get PTSD.
Okay. And at Family Care Center, you guys specialize in helping people that need help with this. And of course, there are treatments that come along with it. That's what you guys utilize to get people on the other side on the right path and journey. What are some of those treatments that you like to hone in on and utilize?
Well, we like to use the whole gambit at Family Care Center, so all part of the biological, psychological, and social spiritual model. Part of that might be meds to just get you to sleep, reduce those symptoms, and then get you through the talk therapy. And that's really the durability. A trauma-informed, focused, evidence-based talk therapy. And this might be something like cognitive behavioral therapy, prolonged exposure, EMDR, all of these things we use at Family Care Center.
And there is something called CPTSD. We just talked about PTSD. What is the difference between the two? Sure.
So the C stands for complex or chronic. And so when those symptoms don't abate even with some treatment, and might even require TMS, they might be longer than 6 months. And so some of these people have struggled for years. One, they sometimes suppress just to get through the day, and once you suppress, it actually can repress things, and then you don't get to pick when they come back up.
And TMS is something that we've talked about a lot, you and I, and on our show. And this is something else that can also be used in treating people, right, with PTSD?
For sure. So I've been treating PTSD with TMS for years. And although it's not FDA approved, there's a wealth of information to say, hey, these can reduce a lot of those symptoms so I can get you through talk therapy. And we've had some great successes at Family Care Center. I
was going to say, what have the responses been like from people who have actually taken part in TMS that have PTSD?
Yeah, so what we usually see is, one, getting you to sleep, having that hyper-arousal go down dramatically, kind of turning down the volume of your whole existence so you can get through that talk therapy. We have about a 50 to 60% response rate, which is far better than the medications.
Okay. And if there is someone watching out there that suffers from PTSD and they want help right now, what is the first step they can take in contacting you guys?
Sure. So I'd look at our website, I'd give us a call. If you're in the VA system, we're going to get you hooked up with them, or we'll work through them. For all the communities or your insurances, we're going to work through them. The first thing is asking for help.
That's right. All right. Dr. Weber, thank you so much for coming on in here, answering all of these seemingly difficult questions, but also being a bright light in our community and helping folks out there. We appreciate it. We're going to give folks more information here. You can learn more about Family Care Center online at fccwellbeing.com or give them a call, 888-374-5066. We want to say thank you again to Family Care Center for sponsoring this segment.